We've been seeing a lot more of this recently. Viral videos of people refusing to wear their masks and then reacting when they're told they have to. So, what's going on?
We sent our Joy Wang to get some answers for you. And Joy, you spoke with Dr. David Scrase earlier.
I did. It all started when I noticed this photo posted on Facebook. We added the word false all across it so people won't keep spreading false information. We understand it can be frustrating when you're told not to wear a mask in January and now it's mandatory. Here's why.
People are frantically studying these issues to get evidence to guide the whole world about what the best thing to do is. So, we had zero really reliable information that we could use to fight this pandemic when it started, because it's called the novel coronavirus. Novel meaning new, never seen before. And so there's just a ton of research data that's coming out now that gives us some guidance.
Like we've learned, you don't need to have symptoms to spread COVID-19. So when you're at the grocery store or just out in general, you should assume everyone around you could be COVID positive, including you. And that mask helps protect those around you. Some other rumors that the virus is too small and that wearing masks can decrease oxygen intake. Let's go back to medical professionals for the answer.
The size of an oxygen molecule and a carbon dioxide molecule are exceedingly, exceedingly small. Way, way, way smaller than the COVID virus itself. There's usually two arguments that are combined that aren't really logical. One is that the mask keeps carbon dioxide in, but it doesn't filter out COVID, which is, thousands of times bigger than a carbon dioxide model. So it makes no sense whatsoever that it's impossible that both of those could be true.
That fact alone debunks a lot of other stuff on here. Think about it. Medical professionals have been wearing masks for long periods of time, way before everyone else was required to. And Dr. Scrase has no doubt, especially after looking at 14 different studies, that wearing masks works and saves lives. Here's him citing a study.
An estimated 230,000 to 450,000 COVID-19 cases were prevented in states that enacted requirements for mask use between April 8th and May 15th. So we were one of those states that we strongly encouraged it now. It's a requirement. And so that's 500,000 cases, which is 5,000 deaths prevented, but they do work. They are effective.
So, Joy, we've also seen posts from people showing a printed card that basically says because of HIPAA, they don't have to disclose why they're not wearing a mask, and then they refuse to wear one.
So Dr. Scrase says there are some people with severe breathing disorders who might not be able to wear a mask. If that's you, the public health order states you'll need a note from your provider, not something you printed online. Dr. Scrase also says some of his patients will even run their oxygen under their mask to be safe. Back to you.